We have three persons who will be bringing opening remarks. We have Ms. Deirdre Clarendon. She is Division Chief of the Social Sector Division of the Caribbean Development Bank. We also have the coordinator of the SPC Office of the Pan American Health Organization, Mrs. Jessie Choutenay. And we also have from the Caribbean Broadcasting Union, the Acting Secretary General, Ms. Hilda Cox Bullen. And then we have our technical presentations, and we're pleased to welcome two journalists who will be bringing us some examples of responsible coverage from the field. They are Charmaine Clark, Managing Editor from the Jamaica Observer, and Emmanuel Joseph, President of the Barbados Association of Journalists and Media Workers and a writer with Barbados Today. Our technical presentations will be done by Ashley Baldwin. She's a specialist in media and communication, public affairs in the communications department at PAHO. And we also have Eldona Boisson. She's an advisor responsible for disease surveillance and epidemiology. And then we have Claudina Cayetano. She's an advisor for mental health at PAHO, along with Elisa Prieto, advisor for NCDs and mental health from the sub-regional office. So a really packed panel, and we are all excited to be here. We're going to start with those opening remarks. I'm going to ask Ms. Clarendon, please, to start us off with her opening remarks from the Caribbean Development Bank. Ms. Clarendon, over to you.
Sir, good morning and thank you, Lisa. Can you hear me?
Yes, we can.
Good. Good morning to our colleagues from PAHO, Mrs. Jessie Choutenay, Dr. Eldona Boisson, Dr. Claudia Caetano, Dr. Elisa Prieto, Ms. Ashley Baldwin, Ms. Charmaine Clark, Managing Editor of Jamaica Observer, Mrs. Hilda Cox-Bullen, Secretary General of the Caribbean Broadcasting Union, Mr. Emmanuel Joseph, President of the Barbados Association of Journalists, and I think we have Dr. Joy with us this morning. Morning, everybody, media representatives and health communicators, colleagues from other partner associations. Thank you for joining this webinar on responsible reporting on COVID-19 for journalists and communicators. The Caribbean Development Bank and the Pan American Health Organization are partnering with the Caribbean Broadcasting Union to deliver this event. I am pleased that so many of you, despite the little hiccup this morning, have joined us today, given your very hectic schedules. The past 3 to 4 months have been an extremely challenging period for the Caribbean. The COVID-19 pandemic has resulted in large numbers of people being infected. In many cases, we have had some deaths. We have severely undermined activity in key economic sectors where the unemployment rate has been increasing. We have weakened government finances and stretched healthcare and social protection systems. Not surprising, the most vulnerable in our communities, that is female single heads of households, the elderly, children, persons with disabilities, and persons living in poverty are bearing the brunt of this epidemic. We are also expecting the knock-on effects on mental health and psychosocial well-being to be significant as people experience fear, depression, and anxiety. Even as the region grapples with its COVID-19 response, the 2020 hurricane season, which is predicted to be an above normal one, got off to a busy
I'm sorry to interrupt, but I think you may be muted.
Yes, everyone was, yeah.
There you go.
Okay, it seems that I just said that my host muted me, so I'm not sure what happened. Okay, just to say that CDB places very high priority on resilience as a key requirement for sustainable human development. In this regard, we have been collaborating with PAHO since early 2018 to strengthen individual and social resilience in the region by enhancing capacity for mental health and psychosocial well-being. More recently, and with the emergence of COVID-19, we have expanded our coverage to include the pandemic. This morning's event is the first of 4 webinars that we are launching for journalists and health communicators. Our communities are totally reliant on you as communications professionals to provide responsible and evidence-based coverage of the pandemic. We all know the new concept of fake news. CDB and PAHO are therefore pleased to partner with the Caribbean Broadcasting Union in offering this virtual training as part of a wider response to building regional capacity for risk communication and community engagement. 2 experienced journalists, Charmaine Clark, managing editor of the Jamaica Observer, and Emmanuel Joseph, president of the Barbados Association of Journalists, have been invited to join our team of resource persons to lead today's exchange of views and ideas on effective coverage to reduce health risks and save lives. In the coming weeks, we'll also be working with social media influencers and DJs to build their capacity for risk communication and engagement. Importantly, building on our Stronger Together campaign from last year, we'll be running a regional communication campaign to assist communities to better cope with the psychosocial impact of disasters such as COVID-19. We expect to raise awareness as well as reduce the stigma about seeking mental health and psychosocial support. I invite you today to participate honestly and freely in today's discussion and the upcoming webinars. With your cooperation, CDB and PAHO will reach larger and more diverse audiences. In this way, we can make meaningful contributions to the mental health and the psychosocial well-being of the people across our region. I want to say thank you and have a productive day. All the best.
Thank you very much, Ms. Clarendon. Thank you very much. Talking about the role of CDB and that important partnership with PAHO and now also with the Caribbean Broadcasting Union. I'm now going to welcome Ms. Jessie Choutenay. She is coordinator for the sub-regional program of the Pan American Health Organization to bring opening remarks. Jessie?
Good morning, everybody, and a warm welcome from the PAHO Caribbean office. I understand that we have close to 200 persons that are registered for this virtual training of communicators reporting during COVID-19. The majority of the Caribbean countries, I understand, are represented, and we have a great mix of journalists, health communicators, partner organizations. We have journalists who work on print, TV, radio, editors, writers, managers, and even students of journalism. Thank you so much for joining us this morning for what I think is going to be an interesting and informative session. As was mentioned by Ms. Clarendon, since the end of January, early February, our lives have been transformed due to COVID-19 in some way, shape, or form. COVID-19, because it's a new virus and because it's highly contagious, the information, the evidence around it has been evolving at a very fast pace. And this has fueled rumors and false information, which has spread faster than the outbreak itself. As professionals working in this space, we have the responsibility of keeping up with the evidence and ensuring that the public is properly informed. Media has an important role to play in keeping people informed and ensuring that information comes from a trusted source. We're so happy to be partnering with the Caribbean Development Bank, as well as the Caribbean Broadcasting Union on this initiative. The focus of this session is on mental health. The pandemic has not only been affecting our physical health, but increasingly we have evidence of how it's affecting our mental health. We've been faced with prolonged periods of lockdown, physical distancing, and separation from friends and family. Schools are closed. There's homeschooling and teleworking. We also face uncertainty as large numbers of people are affected by loss of livelihoods and sudden uncertain futures due to the economic consequences of COVID-19. This unprecedented situation has taken a toll on our mental health, triggering reactions such as fear, depression, anxiety, and worry. Against this backdrop, people need accurate, timely, and frequent information via reliable channels. We need tools so that we can adopt positive behaviors to promote mental health and psychosocial well-being and reinforce coping mechanisms. In this session today, we'll share with you some tools and some tips for self-care, as well as a communication campaign called Stronger Together to support mental health and psychosocial support. And we thank the CDB for the partnership in this campaign. As mentioned, this is the first series of webinars that we'll be hosting, and we hope that this initiative will strengthen our partnership with journalists as we strive together to provide high quality information and evidence to support reporting on health issues. Subsequent sessions will deal with stigma in the context of COVID-19, gender-based violence, the economic impact of COVID-19, and we also hope to get into sessions around climate change in the context of COVID, given that we have officially entered the hurricane season. We want to make this platform informative, interactive, practical, and useful to you in your work. We look forward to hearing your feedback so that we can improve on future sessions so that they work for you. I know you're all busy and you have many demands on your time. Thank you for spending your time with us this morning, and I hope you enjoy the session. Thank you.
Thank you so much, Jessie. And I want to also acknowledge the presence of Executive Director of the Caribbean Public Health Agency, Dr. Joy St. John, who is joining us for some of the session this morning. And we also have a number of CSOs and health communicators who have joined, and journalism students. So that's great. That's an unexpected audience I didn't expect to have today. So that's wonderful. We now ask Ms. Hilda Cox-Bullen, she's Acting Secretary General of the Caribbean Broadcasting Union, to say a few words. They were very eager to partner with us to make this a possibility. Ms. Cox-Bullen.
Good morning. Good morning to the representatives of PAHO and the CDB, presenters, and all participants. And a special welcome to the students, the journalism students. It's really great to have them participate in such an event. The Caribbean Broadcasting Union's mandate includes the facilitation of some broadcast services, representation, and training of the staff of our members in support of a unified Caribbean community. We are pleased to partner in this aspect of training, which addresses that mandate. More so, we applaud PAHO and the CDB for facilitating such, particularly with some focus on the evolving subject of mental health and its related psychosocial aspects, as underscored during this period of COVID-19. The response from participants speaks clearly to the continued need for training. And as we move forward to the next series, we hope to see similar participation. I trust that you will share your experiences for the benefit of each other towards the final goal of a better informed self and community, and at the same time, assisting us in understanding your further training needs. On behalf of the President and the Board of Directors of the CBU, I wish you a very productive session. Thank you.
Thank you very much, Ms. Cox-Bullen. So we have our opening remarks over, and I know the presenters are eager to get going because we have a lot to cover in 2 hours. So I'm going to jump right in. I'm going to welcome our first presenter. She's Ashley Borden. She's a specialist in media and communication in the Public Affairs and Communications Department at PAHO in Washington. And I'm going to have her say a few words and then jump straight into her presentation. Ashley.
Hello, everyone. Thank you, Lisa, for the introduction. So as Lisa said, I'm Ashley Borden. I'm one of the media and communications specialists at PAHO headquarters in Washington, DC. And I'm just going to be giving sort of the very general overview of ethical reporting issues as it pertains to COVID-19 and global pandemics a bit more widely. So I've been looking at the participant list, and I probably know a lot of you. If you've contacted us for media inquiries or interviews, the chances are that it's me that you've been in touch with. So it's great to see you all here. I'm going to share my presentation. I'm the first one that's doing it. So if there's any technical issues, please just write in the comments and we'll try to address them straight away, keeping in mind that there's several of us connected from various homes in various countries. So I hope this goes well. Let me see. Current slide. Maybe Lisa, if you could tell me if you can see the presentation as soon as I start sharing it, because I won't be able to see any of you.
It's not on us yet.
Okay.
It's coming. Yes, you're good.
Brilliant. So what we're going to look at with this presentation, really things journalists and the media to really help promote responsible coverage, achieve its objectives, and ultimately keeps people safe, which is what, you know, our main aim is generally. So the presentation is based on two guides that have been developed by PAHO for reporting in the pandemic. The first is the COVID-19, an informative guide, and that's general advice to journalists. And the second is something that one of my colleagues, Eldona, is going to go into in a bit more detail in her presentation, which is looking at the glossary and the terminology when it pertains to outbreaks and epidemics. So we're very aware that at health organizations, sometimes we use quite technical language and sometimes we use quite technical concepts. So the idea of this guide is that journalists can really use this as a resource to help them interpret those technical concepts in a way that's then going to be able to facilitate comprehensible communication to a general public audience. And those guides can be found on our website. So if you look at the sort of black link in the middle of the slide, you can see it there. So www.paho.org/coronavirus. So why is it so important that we talk about responsible reporting in the context of a pandemic? Well, the reason is that the media plays such a huge role in helping PAHO, governments, and other health organizations to achieve their objectives. So when it comes to COVID, our objectives are threefold. The first is, of course, to save lives. The second is to protect healthcare workers. And the third, which, you know, we sort of read about endlessly in the media and hear about on the television, is to flatten the curve, which again is something which is going to be discussed in Eldona's presentation on the on epidemiology and how to interpret these concepts, because flatten the curve was something which, you know, probably most people hadn't heard about prior to COVID-19. So just as it's our objectives, it's just as important that the media joins us in ensuring that when it comes to COVID-19 reporting, those are some of the primary objectives that are kept in mind too. So how can the media help us to achieve those objectives? Well, the first way is by offering truthful information. So there's lots of different kinds of media outlets. Some are more sort of scandalous than others, I guess. But the most important thing when it comes to public health and when it comes to ensuring that people are well informed and that have the information in order to make decisions about saving their own lives and saving their families' lives and making sure that everyone is safe, truthful information is absolutely key. It helps prevent health risks, it helps reduce the spread, and it also helps overwhelming health services with, you know, cases which could otherwise be prevented. The second is by confirming and avoiding the dissemination of erroneous information and rumors. So quite often, you know, we might read an article which says something and we're, no, that sounds a bit dodgy, or we'll read something on Facebook or on Twitter. And there is a temptation, because that information is quite juicy and quite interesting, to press click, to share it, to develop an article about, you know, how hair dryers might help kill the coronavirus. But what's really needed is for journalists to investigate the sources of that information before sharing it or using the information as the basis for an article. The third reason is to connect rapidly with the public in clear language that is easily understood. So again, quite often when we look at health organizations, when we look at, you know, to a certain extent, ministries, it's very tempting when you have lots of people who are scientists and who are very immersed in the technical information to communicate in a way that can only really be understood by our peers. And the role of journalists is to take that information and to translate it into terminology that can be understood by everyone. And that's one of the vital roles that you guys are playing in this pandemic at the moment. And then the fourth and final reason is to inspire people to act collectively. So particularly in the context of COVID-19, we know that there are certain public health actions that can help flatten the curve and that can help stop the spread. But it's no good if one person is taking those public health actions or 10 people are taking those public health actions. We really need everyone to come together as a society and to work collectively towards those common goals that I outlined right at the beginning of the presentation. So what do we need in order to achieve that? Well, we need journalism that's ethical, we need journalism that's committed, that's educated and informed, that's not sensationalist or alarmist, that reports truthfully, that uses reliable sources, and that confirms information. And we're very lucky that during this presentation, later on during this presentation, we have journalists from the Caribbean here today who are going to be able to give examples of reporting that really sort of ticks all of those boxes. But that doesn't mean that there's not challenges with ensuring that those objectives are met. And those are challenges that sort of go beyond, sensationalist or erroneous reporting, and that are really to do with sort of the circumstances in which journalists are currently working at the moment. And that's without going into the mental health issues that another one of my colleagues is going to discuss a bit more in depth later on. So the challenges around COVID-19 primarily relate to the fact that it's a new virus that emerged early this year. It's a virus which, throughout the course of the past few months, we've been finding out more about each day. Sometimes that information has been changing. It's created sort of a very uncertain environment. And so journalists haven't had, no one has had, but including journalists, as that's our target audience at the moment, haven't had all of the facts right at the beginning, because we're constantly learning about what those facts are. So there's been uncertainty, there's been information that's been changing as we learn more and base our recommendations and update and modify our recommendations based on that sort of ever-changing scientific information. There's also a limited access to experts. So I'm sure many of you who have contacted me asking for interviews with the PAHO spokespersons will be very aware of this. We have the people that know what's going on, are working on the pandemic, are talking about the pandemic. Their agendas are really full, and it's quite difficult to get that information confirmed on the timeline that journalists like to and need to work as well, which is a challenge that, I guess collectively perhaps we can discuss after this ways that we can help overcome it. There's time pressure to get news out. So there's the temptation, okay, I need an interview, I need someone to confirm this information. That's not quite happening at the time frame that I need it to happen, but I still need to, go to print at 6 o'clock in the afternoon. So there's that challenge to work with. There's also the challenge of the public health measures that most countries have had to implement in order to stop the spread of COVID. So we have, journalists who are working in conditions where there's confinement, there's curfews, people are on lockdown. It's not so easy to get out and about, to film things, to talk to people. We're really having to rely on social media, on email, on telephone in order to get the facts that we need. There's contradictory messages. We have some people saying one thing, making one recommendation. We have other people saying another thing and making a different recommendation. Who do we trust? How do we know what's right? These are all difficult questions that journalists have had to deal with since the very beginning of the pandemic. There's changes in distancing measures. We're experiencing them now, which is related to the evolution of the scientific information that we're being presented with. There's insecurity, and there's also trust issues. So, can I trust this ministry? What are their objectives when they're giving me this information? Can I trust this organization? You know, does this organization know what it's talking about? Can I trust this expert? So it's all created an incredibly difficult environment for in which journalists have to work at the moment. However, it's so important that we really focus on achieving these goals, really because of this information, which is from the Reuters Institute. So when it looks at how people are getting information and how people are getting misinformation, particularly, 20% of erroneous information as it pertains to COVID-19, and I guess we can apply this to other pandemics, is coming from top-down sources. So when we talk about top-down sources, we're talking about prominent people, celebrities, trusted media outlets, et cetera, et cetera. 20% might not look that bad, but then we look at if a person of influence is spreading erroneous information, that's then being shared 69% on social media platforms. So this is why it's so important that all of the reporting is as tight as it can possibly be, because even though it might constitute a minority, when it sort of filters down to the general public, that's the sort of information that's spreading like wildfire. So what do we need to do in order to ensure that journalists are helping to keep people safe and to achieve those three objectives? Well, the news media has a key role in building public trust. We know that. There's many newspapers, magazines, radio and television programs that, you know, people hear something and these people have done their research, they've done their fact checking, they've done their work, they know what they're talking about. A population that trusts the authorities will follow recommendations for prevention. So a population that's receiving verifiable, fact-checked information that's coming from reliable sources, that's coming from ministries, that's been dispersed to media outlets in that particular country, that's been dispersed to sort of national level media, is more likely to follow the recommendations than someone that's not. And the more responsible we all are in prevention, the better chance we have to mitigate the effects of the virus. So the more people who are receiving this sort of deluge of information, of important and verifiable information about public health measures that they should be taking, are more likely to be collaborative and form part of the solution. So when it comes to building trust, there's three sort of main areas that journalists really need to keep in mind. And the first and probably the most important is to use reliable sources. So what are reliable sources? PAHO is a very reliable source. WHO, the big health institutions, you know, even though when I was talking about challenges, we have to accept that in the context of a new virus, information is changing and information is evolving. You can trust these organizations to be presenting that information. And even though you might think, well, hold on, you were telling me this one thing about masks 2 weeks ago, and now you're telling me something else about masks. It's only because the technical information has changed. And it's not because, you know, there's been a huge conspiracy to mislead the public. Ministries of health as well. The primary objective is to keep populations safe. So if all of the population are collaborative in the implementation of a public health measure, the more likely it is that transmission will be reduced. So again, you know, we need to pay attention to what our ministries of health are telling us to do, who are the most informed as to the particular national context or subnational context in many cases of transmission of COVID-19. And then the third most important thing is to avoid repeating unfounded rumors and always find reliable sources to back up what it is that you're saying. Once a media outlet has spread disinformation, it's very difficult to then go back and say, okay, well, yes, we said that about bananas helping to cure COVID-19 last week, but actually it's really important that you stay at home and you wear a mask when you're out, et cetera, et cetera. So we need to make sure that everything that we're reporting has been fact checked. So one of the other issues that journalists are dealing with currently is the infodemic. So we have the epidemic of COVID-19, and then we also have the infodemic, which is basically an overload of information, facts, rumors, speculation, usually amplified by social media, that make it very hard for people to sift through all of this rumor, all of this myth, and all of these facts as well, because some of it is true, in order to find trustworthy sources when they need them. And this actually makes the health crisis harder to control, because depending on what people are reading, depending on where people are getting their information, that is going to influence the actions that they take. So as Dr. Tedros said, not only are we fighting an epidemic, we are also fighting an infodemic. And that was something that he was discussing back in February, and that certainly continued. It is a time for facts, not fear. The media at the moment can't be focusing on, clickbait articles, scare tactics to make people read. They really need to be focusing on verifiable information. It's a time for science, not rumors. Everything needs to be backed up as much as it possibly can be backed up in the contexts of a new virus. And it's a time for solidarity, not stigma. So when we talk about some of the issues, and particularly stigmatization and rumors, all they do is contribute to panic. And in order to do that, in order to sort of counteract that, we need to ensure that we're reporting with evidence, that we're using sources that are reliable, that we're offering advice that help reduce anxiety, that prevent cases of COVID-19, and that mitigate the disease. So some of the rumors and misinformation that I'm sure a lot of you have heard have been, certainly at the beginning of the pandemic, related to China itself. Where is this disease coming from? There was a lot of examples of stigma against Chinese people. There's also been a lot of examples about stigma against healthcare workers. So, these are people who are going into the hospitals, they're treating people, they're probably exposed to COVID-19, and oh my goodness, they're going to become a source of infection themselves. And actually, it's incredibly counterproductive. We need to act with solidarity at the moment. Now, how can we do that? How can we address some of those rumors, some of those myths, and some of that stigma as media outlets? Well, these are some examples from other areas of the world, which really emphasize the need for fact-checking. So the AFP, who I think are doing this pretty well at the moment, are publishing the myth and also publishing the correction in the same article. So the Australian news report was edited to show that bananas defend against COVID-19. So the AFP are calling out other media outlets that are reporting erroneous information, and that's incredibly important. We have another example of hot air from saunas, hair dryers won't prevent or treat COVID-19. So we're having outlets that are really addressing these rumors head on. And then there was another one. So this was, just move this. This was actually an infographic that was going around claiming to be from the CDC, talking about facial hairstyles and, what kind of beard you needed to have in order to, utilize a mask most effectively. And there it is in clear black and white fact check. There has been an outbreak of coronavirus misinformation. And then the article addresses the rumors one by one that's really been affecting and worrying that particular population. So this is a tactic that news media, that other kinds of media as well, can really use to address these rumors head on. gonna have to move you again. So here are a few tips. The first is to promote protective measures. So what are governments saying? What are international health organizations saying that people should be doing? And how can we promote those and ensure that those are a common thread throughout the articles that we're writing? What can people do to take action off the base of what we're writing? The second is to bust myths. And you can do it incredibly obviously, like the AFP. You know, this is just wrong. You can't prevent COVID with a hairdryer. You can't prevent COVID by eating bananas. You can't prevent COVID by drinking pure alcohol solution. It just won't work. The third is to explain public health concepts in a simple way, which my colleague Aldona is going to go into much more detail. There's lots of things going around, et cetera. What does that mean? And what's my role as a member of the general public in helping to achieve that? And that's really where journalists can step in. And, you know, all of this is happening. There's dreadful things happening, cases arising in certain contexts, but what can people do? The fourth is to put figures in perspective, to not sort of be tempted to use this sort of shocking statistics unless it's, you know, as part of a wider explanation. The fifth is to provide information on when and where to seek medical care. What symptoms does one need to have in order to go and seek healthcare? What can someone do? When is it wise to go to the doctor? When is it wise to, you know, if I'm feeling symptomatic, to go out, if at all? That's really where media outlets can get the information from PAHO, WHO, and can then disseminate that information in a way that's incredibly comprehensible to their audiences. The other is to report progress on new vaccines and treatments. All of this information we have available, as much of it as we know, we have available. And this is something that, you know, causes anxiety, which Claudina, my colleague, is going to go in a bit more detail. But if people know where they stand more or less with the development of treatments and the development of vaccines, then that can help reduce that anxiety slightly. The other one is before publishing stories found in social networks, knowing that 69% of the erroneous information is spread over social networks, make sure they are true. It might be trending, it might be all over Twitter, but that doesn't mean that it's true. And the final one is to provide links and to cite reliable sources of information. It's all well and good us saying, you know, you should wear a mask when you go out. Who's telling us that? Why do we need to wear a mask when we go out? Where is that advice coming from? And when a general public audience realizes it's much more likely to actually implement that public health measure themselves. Some of the problems that we were talking about today, the tips are firstly to avoid sensationalist language. Avoid fueling fear. We are living in an uncertain time. We know this, but fear is not necessarily conducive to taking the public health measures that people need to take. So we should be reporting on the facts or the situation in a particular country and area, but not without what can people do. We need to avoid stigmatizing people and groups. So terms like the Wuhan virus doesn't achieve anything except for link COVID-19 to a population that live in a particular area in a particular country that have no responsibility whatsoever for COVID-19, but that creates that kind of, oh goodness, you know, there's someone from Wuhan, there's someone from a particular country, I should feel a certain way about them, or I should be fearful about them. And that doesn't create the solidarity with which we really need to be acting at the moment. And it's the same with public health workers, et cetera, et cetera. We need to alert the public, but without exaggerating. So what's the practical advice on how people can deal with the situation that's presented in a way that isn't going to create panic, because we know that panic is counterproductive. There are concrete things that people can do. We don't need to, everyone's dying, do this. We need to say, this is the situation as it is, and this is what you can do to help prevent it. We need to avoid repeating unfounded theories. When we start to constantly reiterate something that we know is not true, it creates a dominant discourse around that particular issue. So people will always remember that, bananas will help cure COVID, bananas will help cure COVID. And sometimes we just need to, move on and create contrary information that disproves that, rather than continuing to focus on it. And we need to avoid telling the other side of the story if it has no scientific basis, or if it's ridiculous or incredible. So by all means, reporting needs to be balanced. Of course it needs to be balanced, but we can't look for the flip side where none exists. If the recommendations is, avoid going to bars and restaurants because governments and public health authorities and public health organizations are reporting that that's leading to increased transmission, we don't need to focus on, oh, but some people say that actually it's fine to go to bars and restaurants because it helps promote the economy, or et cetera, et cetera. We really need to focus on the public health aspect at the moment in order to flatten the curve. So here's another great guide that was prepared by WHO, UNICEF, and Red Cross on how to avoid stigmatization. And the discriminatory messages or behavior can lead people to hide the disease to avoid discrimination, which is incredibly counterproductive. It can discourage people from seeking prompt medical care. So for example, if stigma around medical staff and the increased chances of them having COVID-19 is constantly being disseminated in the media, then if I have certain symptoms and I have to go to the hospital, I might be worried that, oh my goodness, I'm going to have to go to the hospital. And then, if I don't have it, my friends and neighbors are going to be worried about the fact that I might have picked it up in a hospital or healthcare center. And it's just incredibly counterproductive, because we need people to be following the advice and getting the care they need. Wording is important. So we need to say people with COVID-19 and not the depersonalized cases or victims. This is a virus that people can easily acquire. They're not victims of COVID-19, and they're not just mere cases either. These are people with, hopes and dreams and families and jobs and whatever else. And it's much better to refer to people contracting the virus rather than spreading the virus. Spreading the virus puts the onus and the blame on the people that have COVID-19. And that creates in itself a stigma. Someone very often can't help but disseminate the virus, and really that's not their fault, and the onus shouldn't be on them. And the final recommendations for avoiding social stigma are to keep a positive tone and emphasize the effectiveness of prevention measures. So by all means, we can report on a particular situation, but we also know, with the wealth of evidence that we have, not just from our region, but from other regions as well, that public health measures help reduce the curve, help flatten the curve and reduce cases. And that's what we need to be hammering home to our audiences. And we also need to share stories that humanize the experiences of people affected by COVID-19, and stories that show support for health workers and others on the front lines of the response to this outbreak. And the final thing to remember is that as journalists, as people that work for international health organizations, as members of the government, as members of the general public, we are all in this together. This is not the first pandemic that we've had. It is not the last pandemic that we're going to have. And we really need to now set the tone for how we effectively report on the pandemic in order to keep people safe and to protect each other. Thank you very much. That's the end of my presentation. And if you have any questions, I'm more than happy to answer them.
Yes, thank you very much, Ashley. There is already a question in the Q&A section. So I'll read that one for you. And if there are any other questions, please just raise your hand. We won't have a lot of time right now because we still have other presenters, but I'll give you the first one from Guyana, from Jerry Diaz. Journalists also have been on the front lines during this pandemic. This has to be acknowledged. There is going to be a new normal as the pandemic winds down. But can this new normal be taught in schools as curriculum so that people sanitize at all times regardless of the virus? Is this on the horizon? So we're talking about the new normal and perhaps seeing journalists not just as journalists, but as people. And
Yeah.
the new normal.
I think, you know, journalists have been on the front lines of various things since journalism existed. And I think that certainly within the context of this pandemic, which is so widespread and is affecting so many different people and communities and countries, that's been hammered home now more than ever, that, you know, a journalist that wasn't necessarily a war journalist or, you know, going into sort of incredibly notoriously difficult contexts is still having to work on the front lines and is still, to a certain extent, putting themselves at risk. Although, of course, there's measures that have been put in place to protect people as much as possible. And as far as the new normal is concerned, you know, that's certainly terms that have been bandied about considerably over the past few weeks and the past few months. And, you know, one thing that we've noticed in particular is that, and we actually did a Ask the Expert on this a few weeks ago at PAHO, for PAHO Caribbean, I think. And we were talking about some of the main public health measures that the international organizations and that governments have been asking people to do. And the main one is hand washing. And the fact of the matter is that infection specialists have been telling us for years that this is what we should be doing and this is how we should be acting. And it's only now that we're in this context that we're really starting to implement these measures in such a widespread way. So I think definitely people are realizing more and more that, you know, measures like hand washing, et cetera, like not, you know, necessarily being in sort of crowded spaces, the implications that could potentially have on the dissemination, not just this virus, but of, you know, other things as well. So I think as we move forward, there's definitely going to be more of a focus on ensuring that more importance is given to those basic health measures that we know can not just stop the spread of COVID-19, but can also stop and prevent the spread of other things too.
Okay. Thank you very much, Ashley. I don't see any other questions. I'm going to give you 2 seconds because we're going to keep moving and you can ask your questions a bit later as well. I want to say we have representations from Barbados, Cuba, Turks and Caicos, Guyana, Grenada, St. Vincent and the Grenadines, Curacao, St. Martin, Jamaica, and Canada. So we have quite a wide representation here. Are there any other questions right now for Ashley, or can we continue on to the next presentation? And you can always ask Ashley. She'll be with us the whole time. She's not allowed to leave. So if you have a question later on, she'll still be here. Oh, there is another question. Okay, Kimberly D'Souza, as much as we have a responsibility to write the truth, how can we find the sweet spot between writing the truth, being honest, but writing the headlines in a way to draw in our readers, particularly as it relates to online news sources, since many of us are, quote unquote, fighting for views on our page? That's a big one.
Yeah, that's a tricky one. And I think it is, you know, there's definitely sort of looking at it from the perspective of journalists, particularly online journalists that are looking for clicks. You know, that's definitely a dilemma. But I think in the context of a pandemic specifically, the responsibility needs to be first and foremost on ensuring that people are taking the measures that they need to take to flatten the curve and halt the spread. Now is really not the time for sensationalist headlines. And of course, we should report the facts. That's the point of journalism. But we just need to make sure that those facts are completely backed up and that we're also offering what can people do in order to help, you know, address X dreadful situation that we might be reporting on. So I think it's just about, achieving a balance on the one hand between presenting facts and presenting solutions as much as possible, and on the other hand of just acknowledging that within certain contexts, now is really not the time for sensationalism because there is so much at stake.
Yes, I'm gonna allow one more. Jennifer, I'm gonna allow you to talk so we have a little bit more conversation here. So Jennifer, this will be the last one for now. You can ask your question. Jennifer Gumps, go ahead. You have to unmute and then you can go ahead and ask your question. Okay. All right, I'll ask it.
Yeah.
I'll ask it for you. Change of information from reliable sources could sometimes come from how do we handle contradictory sources? I think that's the question. I was hoping she would ask live, but I think that's the question. How do we answer contradictory sources?
I think there's two things. I think verifiable sources, which are the ones that I've mentioned, are very unlikely to be contradictory. However, when you look at information that's being disseminated by international organizations, we're always looking at sort of broad brush contexts. And when it comes to Ministry of Health information, that's usually a bit more specific when it comes to the situation of X country or, X sub-region in a particular country and what that particular population needs to be doing. So I think it's, instead of contradictory information, it's probably more of a honed focus on a particular measure that people should be taking rather than, don't do what WHO are telling you to do something else. So I think it's just about looking at the broad information that's being given and how that can be applied at a national and subnational level.
Well, thank you very much, Ashley. You stay there because we'll be engaging you some more later on. Thank you very much. And everybody seems to really like the presentation and they want to know if they can get a copy of the presentation. So we'll discuss that.
Yes.
I'm going to move on now to Dr. Eldana Boisson. She is going to be discussing the key epidemiological concepts for an evidence-based coverage of the COVID-19 pandemic. Some of those terms we've been hearing a lot about, the curve and flattening the curve and what it really means. Dr. Boisson, welcome.
Hi, good morning, everybody. I hope you can see my screen. Can you?
Yes, we can.
Okay, let me just put it on slideshow. You seeing slideshow? Great. Okay, so good morning, everybody, and thanks very much for having me, Lisa. I'm one of the epidemiologists who works with the Pan American Health Organization, and I'm actually part of the incident management system team for COVID-19. And Lisa's asked me this morning to talk to you a little bit about epidemiology, but in the context of COVID-19. Epidemiology is a broad topic. And so in this few minutes, I'm going to speak about some of the terms and so that you would have been hearing since the COVID-19 pandemic began. So in the middle, you see the definition of what epidemiology is. It's a big mouthful, the study of the distribution, determinants, and control of health-related conditions or events in a population. So if we take that apart a little bit, when we speak about study, we could be speaking about an ongoing study like surveillance, an observational study, or some kind of analytical research. And all of that is part of epidemiology. And what are we studying? We're studying who's affected, where are they being affected, when is this happening? Epidemiologists always break down our data by person, place, and time. What are we studying about these people? We're looking at the factors that are influencing their health. What is causing disease? And then we're looking also at control. We're looking at how do we actually handle this problem affecting these people? And what problems are we talking about? We could be speaking about diseases like COVID-19 or causes of death. We could, when we speak about causes of death, it may not be a disease, it may be homicide, for example. Health-related behaviors, health-seeking behaviors or not seeking. And usually we're looking at populations of people, but sometimes we do investigations among things, vials in a lab and so forth. So as you can see, epidemiology is very broad, and I'm definitely not going to go through everything about epidemiology in these few minutes, but I'm going to try to focus on some parts that are relevant to some of the things you've been hearing since this outbreak. So in a little timeline, as you know, back in December, that's when COVID-19 appeared. At first, it wasn't COVID-19 because they didn't know what it was. It was new. And so in December 2019, it started off as an acute respiratory syndrome of unknown etiology in Wuhan. And then with investigation, they got to find out, oh, this is a coronavirus infection. But we've had coronaviruses before. SARS that we had in Canada and China, a few places before, and MERS, and the common cold is caused by coronavirus, but this was a new one. And because it was first seen in 2019, it was called 2019 Novel Coronavirus, nCoV. And then on the 11th of February, it was named COVID-19. That's a disease, as you see, for coronavirus disease 2019. That is different to the virus that causes the disease. And the virus that causes COVID-19 is referred to as SARS-CoV-2, Severe Acute Respiratory Syndrome Coronavirus 2. Why 2? To differentiate between SARS that we saw some years ago. So we have the disease and we have the virus name. And then on the 30th of January, we heard about the WHO Director General declaring COVID-19 a public health emergency of international concern. The acronym is FAKE, which is very unfortunate because it's certainly not. So what is a FAKE? Well, there's a clear definition of what it is under the International Health Regulations, which is an agreement, a legal agreement between WHO and all the member states. And in the International Health Regulations, or the IHR, a FAKE is described as an extraordinary event that is determined to constitute a public health risk to other states through international spread of disease and potentially requires a coordinated international response. This definition actually implies that a situation is possibly serious, unusual, or unexpected, has implications beyond the states where it was found, and might require international action. And you can see that COVID-19 pretty much meets all those criteria. Now, who decides that a FAKE is occurring? It's declared only by the WHO DG. But in fact, it is not the DG who decides. To declare a FAKE, a convening of a committee of experts, which is called an IHR Emergency Committee, is brought together to advise the WHO Director General whether to call a FAKE or not. Where do these experts come from? Well, there's a roster of experts that countries, every country around the world, including in the Caribbean, can nominate an expert to be on this roster. And so they're experts in all sorts of different areas. And depending on what the disease is, what the situation is that has to be looked into, experts, appropriate experts relevant to the event are pulled from this roster. They come together, examine all the evidence, and so advise the Director General. They also at the same time have to give temporary recommendations, including any health measures that are to be implemented by state party who is having the FAKE, other state parties, in order to prevent that spread and also to avoid unnecessary interference with international traffic. So this is how it comes about. So it's a very transparent mechanism. It's not decided by one person. Later on, we heard 11th of March, a pandemic was declared. So what does that mean? It's a term, it's an epidemiological term. So in order to get to pandemic, I'd like to just define three other terms. Endemic means usually occurring levels. And if you look at my little graph there that shows number of cases along the vertical axis, and I apologize, I haven't labeled it properly and so forth, but just so that it could fit. And along the horizontal axis, we have time, day 1, 2, 3, so forth. So your endemic period is the normal cases you expect to see, because there's always disease at some underlying level. An epidemic is when you have an increase in cases clearly in excess of what you expect to see. So you would see in the endemic, you have little blips and dips, but it's all within an area you expect to see. But when it goes clearly above what you expect, you have an epidemic. So in some countries, one case of a disease can be an epidemic. For example, in most Caribbean countries, all Caribbean countries, we don't have cases of plague. So if one day we had a case of plague in a country, that would be an epidemic because it's above what you expect to see. Another term you hear is outbreak. An outbreak is exactly the same definition as an epidemic. I guess the difference is in public health, we tend to use the word outbreak, and journalists, for some reason, prefer the word epidemic, but it means exactly the same thing. And so what is a pandemic now? Pan meaning everywhere. It's a worldwide epidemic or outbreak. So it's an outbreak or an epidemic that's happening throughout the world. COVID-19 is not the first, as Ashley said. We've had H1N1, for example. Just a little note about a cluster. You may have heard about a cluster. That's a group of cases that are gathered together at a particular time or in a particular geographic location. It may be parts of a country or a whole country, or a group that have a common exposure. I may have a cluster of persons who all had the same exposure. Now, the cluster may not take you to levels that are above what you expect, but it's just that they're clustered either in time or location or by exposure. So those are some of the terms that you would have heard as well so far in this pandemic. Now, what I showed you before, the little graph, is actually what we call an epi curve or an epidemiologic curve. And this is something epidemiologists use all the time. Here, it shows the number of cases on the vertical axis and the date of onset, the date the case occurs. So you would see if we have a point source epidemic or outbreak. And when we say point source, there's one single source of the outbreak. It will show you when the first case occurred. It will show you when it peaked. It will show you when it petered out. It will show you the last case. So it shows you when it starts, when it ends, how long it lasts, when it peaked, or in fact, if you see it continues just going up and up, you know it hasn't peaked. How big is it? How many cases? Are there some atypical cases? You may find that last case may have occurred way after the others. And epi curves are something that epidemiologists draw all the time because it tells us where we are in the epidemic. And ideally, when we have an epidemic, we want to see
Okay, we have a little freeze here. Let's hope it comes back on soon. Aldana, your video is frozen and your audio. So let's just give her 2 seconds to see if it picks back up. If you're hearing me okay, Ashley, you're hearing me okay, right? Okay. So let's just let that settle a little bit. I have a question for you, Ashley. Maybe we can do this question so it gives that time to come back in.
Of course.
Okay, I think she has, hold on, let's see.
You're on mute, Aldana.
Aldana, she's back.
Okay. Are you seeing my screen still?
No, you have to reshare now.
Okay.
Okay, Ashley, you'll get your question later. Okay, you're good.
Is this where you lost me?
Go one before that.
One before. Just a second. Now it's going forward. Okay, this one?
Yes.
Okay, did you hear any of it or should I just start over?
Yes, we did hear most of it, I think. It was near the end, I think you were about to move on.
Okay, well then let me move on then. So your epi curve, I think I just said that when you find out about an epidemic early and you can do things to slow the epidemic down, this is when the peak becomes flatter. And you talk about flattening the curve. which I'll talk a little bit more about again later on. So you may also have a propagated epicurve. This is where you have ongoing exposure and you get one peak, and then another one, and another one. And this is where you may hear about one spike or one wave, a second wave, a third wave. I want to look at two different types of graphs that you've been seeing as well. A simple frequency graph, which really is what we call our epicurve, as you now know, where you have cases as they occur each day and the number of cases along the vertical axis, and then your cumulative frequency graph. And what the cumulative frequency graph does is it shows you how many cases are occurring, adding up each by time. So this is for the same set of data. And the difference, if you look on the vertical axis, it's much smaller for your simple frequency graph or epicurve. The top is 4,000. On the cumulative, it's 40,000. So this shows every day on the simple one, how many cases are occurring. So you can see which days you have some spikes. On the cumulative one, for day 2, you add up day 1 and 2. For day 3, day 1, 2, and 3. So you're seeing the total number of cases that have occurred on that particular day. And that gives you some idea of burden. I want to just show you one of the graphs that we have in our WHO situation report each day. Now, if we look at it overall, it may look like it's a cumulative frequency curve. But on closer inspection, if you look at the different colors, the orange is Western Pacific, sorry. And it's actually showing each day. And as you see in beginning of January, February, there was a peak when there was a change in case definition. And then it petered out over time up to June. And then the blue is Southeast Asia. And that started to pick up over time. And let's look for the Americas, which is yellow. And you can see that we're going up and down over time, but you can also see that we have not yet peaked because overall it's still moving up. So you need to look carefully to see, are we speaking of a cumulative curve or are we speaking about a simple epicurve? So this one is actually a simple epicurve broken down by each of the WHO regions. So back to flattening the curve, or what we really should be talking about is delaying the curve. In red, what we're looking at is what a curve may look like if we had no protective measures in place. That we get an introduction of cases, we do nothing, and we just let rip. And very quickly, you will see there's a steep incline and the cases shoot up. And at some point, you're going to get so many people infected that it's going to now have less people uninfected than infected. And so it's going to start to peter out. And so if we do absolutely nothing, an outbreak will always burn itself out. However, if we look at our healthcare capacity, the systems that we have, what is the capacity to deal with cases, knowing that we have high mortality against certain age groups you're familiar with by now, older persons, those with underlying conditions. Very quickly, if we do nothing, our healthcare system capacity will be exceeded. And therefore, we will run out of hospital beds. And we're not going to have the capacity in country to deal with not just COVID cases, but cases of anybody with an illness. And we're going to have to start choosing who lives and dies. Who do we give the few hospital beds that we have? So what countries have been trying to do is flatten the curve. And this is something in epidemiology we talk about doing all the time when we investigate outbreaks. It's not a new thing in epi. We want to put measures in place very early in the outbreak. I'm not sure if you can see my pointer, but very early when we just start to see that increase so that we can try to reduce the numbers and we can flatten that curve so that the number of cases you have are within the number that you can deal with in your healthcare system. And so what you're really doing is buying time to be able to put things in place so that when you get cases later on, you can deal with them. you have things in place to deal with the numbers. So we're talking about flattening or delaying the curve. Another term you may have been hearing about in more recent times is the reproduction number, or sometimes it's called the reproduction rate, or the R0 or R0 or RT. So what does that mean? These are really measures for looking at the potential for the disease to be able to spread. The R0 or R0 or reproduction number or rate is the basic one. This is the average number of new cases that each case in a population will create if the whole population is susceptible. So for example, on average, if your RO is 2, it means each infected person will pass it on average to 2 others. That may be, some may pass it on to 3, some may pass it on to 1. We're talking about on average, how many persons one infected person will pass it on to. And this is where your population is completely susceptible. They've never had the disease before, no measures are in place, everybody's susceptible. But then we talk about the effective reproduction rates, which is called the RT, or in some places you may see it written as the RE. And this is when there's some immunity in the population, whether persons have had the disease and had some immunity, or have been vaccinated and have some immunity, or some intervention measures are in place. So not everybody's susceptible in the same way. Now the RT is going to change as your population becomes more immune. The more persons who have been infected, or if they were vaccinated, that are immune, and the more interventions you have in place, so the more prevention you have in place, the lower your effective reproduction rate will be. And so that is going to change with time as the outbreak progresses and as more immune people become immune, and if and when we get a vaccine. So you may have heard about ROs and 1, and what does that mean? If your RO or your RT is more than 1, it means that your outbreak is continuing. It means that each person who gets infected can infect more than 1. So your outbreak is going to grow. If the RO or RT is 1, it means each person infects only 1 person. And so your outbreak remains the same as whatever number you have. But what we're aiming to do is to get your RO or RT to be less than 1. So for each case, you have less than 1 case that is infected. And so your outbreak peters out. And that is what all countries are trying to aim for. Just a couple more terms you may be hearing about. Immunity, I'm sure you're familiar with. If you're immune, it means you're not susceptible to disease. You won't get it. You may become immune because you yourself were infected and your body produces antibodies, or you were vaccinated and so you have antibodies, or your body can now produce antibodies because of the vaccine. So you're safe. So what does herd immunity mean? Well, herd immunity from a disease is when you have protection, when you have a large enough proportion of the population that has become immune. Again, maybe because they had it or they were vaccinated. We're more familiar with using that with vaccination. We want to have enough vaccination to have herd immunity. This happens because when you have a large enough number of people who are immune, then you get a sort of indirect protection from the ones who are not immune, for the ones not immune. So for example, let's imagine that you have 80% of your population is immune to disease, either because they had it or because they're vaccinated. What does that mean? 80% is 4 out of 5. It means that 4 out of 5 of the people who are in contact with a case will not get sick. And if they are not getting sick, it means 4 out of 5 of the people in contact with a case will not spread it. And so the spread of the disease is kept under control. And that is what we mean by herd immunity. It varies from disease to disease. We do not know what percentage of the population needs immunity to get herd immunity for the population. We do for a lot of our vaccination vaccine preventable diseases like measles, it's over 95% who need to be immune. And we can get that by vaccination. Just a couple more slides. Incidence and prevalence. You may or may not have heard about it, but these are very common terms in epidemiology. Prevalence is a measure of how many cases you have in a population at a particular time. So I can talk about my prevalence today or my prevalence for the year. So if I look at the little graphic on the side, and let's consider the population there is that bowl, your prevalence, how many you have at this point in time. It gives you an idea of the burden of the disease at this point in time. Incidence, however, is the measure of the number of new cases during a specified period of time. So new cases, you can talk about your incident for the day, for the week, for the month, for the year. So if we look, it's how many new cases are coming into your population of infected persons. So if we consider the blue balls are infected people, the prevalence is how much you have. The incidence is how many out of your population become infected. And of course, your prevalence depends not only on your incidence, but also how many people die, because if they die, they leave that group of infected people, and how many are cured, or how many people get over it, because they leave that pool of prevalent people. So your incident gives you an idea of what is your risk of getting a disease. What is my likelihood of getting into that group of people with disease? What's my risk of changing from having no disease to having disease? So that's incidence and prevalence. Two different reasons we look at it, one to estimate burden and one to look at risk. And finally, a few terms in the natural history of disease. So let's start at the beginning of the line, where you have your susceptibility. At the beginning, any one person is at a stage of susceptibility. If you have not had the disease, you're susceptible. If you are exposed and infected, there should be written on that chart and infected, exposed and infected, you then go through a period where you start to get pathological changes due to your infection that will cause you to now start to eventually show signs and symptoms. So changes going on for COVID-19 within your respiratory system. This period between when you are exposed and infected and when you start to show symptoms, coughing, sneezing, and so forth, is called your incubation period. And for COVID-19, I'm sure you know by now that it can be up to 14 days. On average, it's about 5 days, but it can be as long as 14. Once you have your symptoms, you enter your symptomatic period. However, when you get diagnosed is usually a little bit after you have symptoms, because before you have symptoms, you don't normally know that you're sick. So you wouldn't just turn up and say, please let me know if I'm sick if you have no symptoms. So usually for any disease, your usual time of diagnosis is after you have symptoms, during your symptomatic period. And then following your symptomatic period, you have your stage of recovery or death, or you may have a period of disability for some diseases. For COVID-19, the infectious period, unfortunately, is not only in the symptomatic period. It starts from a couple days before symptoms into the symptomatic period. And so this is why we say that even though somebody's not showing symptoms, they may be infectious up to about 2 days before. We're seeing that most people, the larger proportion of people, tend to be more infectious around the time when they're showing symptoms, earlier on in the stage. Because remember, your body is going to try to fight the disease. And so as the disease progresses, your own antibodies you produce is going to start to fight the virus and reduce the number of virus particles that you have that can infect others. So these are just some of the terms that you have been hearing about and may hear about. There are many more. We'll have Q&A session if there's some burning one that you would like to ask, I'm available for that. And there is in that glossary that Ashley referred to a lot of these defined. So I just picked out of the wide gamut of all of those we use in epidemiology, those that have been more commonly used and that may be more commonly used in the future during this COVID pandemic. So I thank you for your time. Again, stay informed from reliable websites. There are others. These are the ones from our organization. Of course, your respective ministries of health are ones as well. So thank you very much for your time, and back over to you, Lisa.
Thank you so much, Aldana. I really want to hear my Caribbean people speaking to me. Y'all are typing some questions in the chat, but feel free, you know, if you raise your hand, you can ask a question online as well, because we don't want to just talk at you. We want to have a conversation with you. Jennifer Gums, I see your hand is up. I will allow you, if you're going to speak, to just ask a quick question while Ms. Dr. Cayetano gets ready to talk to you about mental health. And we do have a few questions in the Q&A as well. So Dr. Cayetano, we're coming to you shortly, but Ms. Gums, if you are willing to open your mic and maybe your camera and talk to us, please go ahead. Caribbean people are so shy sometimes. I don't expect journalists to be shy people and communicate. No? Okay, I think there was a question that she asked before that I didn't quite ask properly. So we'll get to that in our discussion period. So I'm going to hand over now. Thank you very much, Aldana. That was very interesting. You took me back to my EPI days. Whew. A lot easier than my EPI classes. Thank you very much. I'm going to hand over now to Dr. Cayetano, and she's going to be talking to us about the mental health aspects of COVID-19. And we know that this is something that journalists have been writing about and talking about a lot. So over to you, Dr. Cayetano.
Thank you very much for the invitation, and to all the colleagues from PAHO in the Barbados office. Thank you, Lisa, I hope that you're able to see my presentation.
Yes, we can.
Fabulous. Okay, I'm very pleased to see that we have so many people who have joined this webinar, and I'm very, very pleased to that there is a moment to take care of, to talk about the importance of mental health. So far, the presentations have been really fabulous, a lot to learn. So I'm really looking forward for the time for question and answer. So for my perspective, I'm going to be talking to you about the stressors that this pandemic is bringing to us. As most of you have been experimenting, fear, anxiety about the disease. And we know that this can be very overwhelming and causing very strong emotions for adults, for children, for adolescents, for everyone actually. And in particular, people who may have pre-existing conditions, people who may have diabetes, hypertension, cardiovascular disorders like cancer, some of these chronic disorders, and as well as people who have mental health problems. So this can be very, very overwhelming. We totally understand. We know that this can happen, and that especially for an outbreak of this magnitude. And what are the changes that we can tend to experience? Changes in sleep, eating patterns, difficulty sleeping or concentrating, again, worsening of these chronic health problems, or worsening of the mental health conditions. So what tends to happen is people may start to increase the use of alcohol, tobacco, other drugs are coping. So we know that there's these stressors, but what is important is how we respond, how we are responding to these stressors. So the issue with COVID that may happen is specifically when it comes to the fear of people falling ill or dead, or we know of losing the livelihoods, we know of people being separated. We talk, we have these travel restrictions, people separated from their loved ones, the isolation, the quarantine, all of these are fears that people are experimenting. And so these fears brings feelings of helplessness, feeling of loneliness, depression, sometimes anger, boredom. And in addition to that, as it was said before by my previous colleagues, the issue of a stigma towards persons who have been infected and their family members, those caring for patients, specific ethnic groups, populations or groups of nationalities. This doesn't help. What does this make is make people become much more fearful and much more anxious, and the way how it is being handled. So additional to this is also the disruption of school, the disruption of our social and recreational activities. This is unprecedented when we talk about, this pandemic. The decline for some people in their income, the issue of food security. So all of this makes, add to this issue of stressors, of becoming stressed out, of becoming anxious and difficulties coping with the pandemic. So mental health and well-being during COVID is very important that we pay attention to that. And we are doing some polling. So I'm asking you to please, it has been sent to you. Hopefully you have responded, and probably you can respond in the chat. In your role, do you think that it's important to report on mental health during COVID-19 pandemic? And so I'm encouraging you to think about that question and let us know what do you think about that. And the reason why I'm asking that too, because when we say mental health, people start to think of mental disorder. They start to think there's a lot of stigma, not only in the Caribbean, everywhere when it comes to mental health, and particularly these kind of issues when you have a stigma. Perpetuate more discrimination, and people that are stigmatized suffer in silence. They don't want to be seeking help. So when we say mental health, people think mental disorder. They're not thinking of the importance of taking care of their well-being. And this stigma, what happens is that it affects people in terms of they're taking care of themselves, their ability to look after themselves. There's evidence clearly shows that stigma and fear around communicable diseases hamper the response. So what is important is facts, not fear. Facts, not fear, will stop the spread of COVID-19. So there is a role for media to play. And this was said before in terms of how stigma is being addressed. So importantly, and I know my colleague Ashley mentioned that, it's very important to look for accurate information. Also very important, which has been done in other countries, and I know in the Caribbean, this is people are doing that, is to share sympathetic local narratives, because we also tend to feel closer to people when we hear their stories from them. But here, keep in mind confidentiality. We need to ask people if it's okay to share their experiences, if it's okay to talk about that. You want to be able to amplify the voices of stories and images of people in your country or your community who have experienced this, and then who are recovered from this, or who have supported a loved one and they're willing to share their story. So it's also important that if you engage people who are social influencers, you remember the presentation from Ashley, you make sure that they have the right information, because if it's the wrong information, then we have some problems here, and that will just help increase the stigmatization. So here, what we want is to make sure that you all know that words matter. How do you use your word? How do you use your language? So we want to encourage the appropriate terminology. People who are being treated, people who have recovered, people who have died after contracting COVID. This is important because, as I mentioned before, when people are stigmatized, people tend to suffer in silence. People do not want to go seek help. Families need to be supported, and they may not do that because they feel like they're being stigmatized. So we want to encourage you to emphasize the effectiveness also of prevention. Before, Dr. Aldona was talking about the importance of prevention, like what do we need to do? How do we support our community? Because then we are looking for, treat measures that are, that will help to be able to flatten that curve. So correct misconception through clarifying common myths based on local culture. This is definitely, so the word that you use becomes very important. So when we talk about mental health, it's very important for people, where they teach about how to take care of yourself. So we talk about this, you teach your children how to brush their teeth, how to comb their hair, how to look after themselves. But very few times we take time in teaching about caring for your mental well-being. What are the skills that you require to be able to look after yourself? So when there is a stressful situation, like we are seeing most people will feel stressed during COVID, and they don't know most times what to do, how to deal with this, because we have not been taught how to take care of ourselves. And we know that, and it's very important to pay attention on what are the skills that we need to be able to stay well, because people would recover better when they feel understood and supported, and when they know what to do to take care of their mental health. And media can make a difference to the well-being of people through the way of they interact and how they communicate. We know it's important to communicate about the public health measures, physical distancing, hand washing, staying at home. That's very important, but communicate about mental well-being, communicate about what people can do to take care of themselves. That is very, as I say, is extremely relevant. So there's messages that we want. People who are affected by COVID have not done anything wrong, and the stigmatization doesn't really help them. They don't deserve, they deserve our support, compassion, and kindness. I think it's important that we think of that. People suffer, so we want to be able to be, to be empathetic to people, to reduce the stigma. We do not want to be leveling patients that have suffered from, that have been diagnosed with COVID, to ensure that they are being supported. So of course, it's very important that you protect yourself and that you be supportive of others. Assisting others in their time of need can benefit, because when you do support someone else, when you do empower another person, that also helps you to feel comfortable. So these are the things that are very important that we want to encourage you, that avoid stigmatization, whether it's because of the stigma or because of the nationality. What we want is that you be empathetic to all people who are affected, doesn't matter where they're from. So when you do that, there's definitely here, it's important to talk about your well-being. So your well-being matters. And if you, so we talk about what we say active daily living. When we say active daily living, ADL, you get up in the morning, you have to brush your teeth, you have to, have breakfast. There's certain things that we do automatically. And when we do that, it's because we know it's important for our mental health, for our physical health most times, but we're not thinking of the importance of our mental health. So the question that we want to ask you, do you take time to look on your own well-being? If you do take time of that, I think, as I say, we're doing a polling, so we want to hear what you do for your own ADL, whether you do take time to take care of yourself. Why do we think that's important? Because before you help others, before you you prepare a story, or before you want to supporting people, you need to look after yourself. And it's the same way, when people were flying, they said to you, look after yourself before you take care of the other person beside you. And if you're a mom, or if you're a daughter and you've traveled with a family member that you love so much, sometimes our first instinct is to go and protect the child or protect you. No, the first instinct is that you need to look after yourself. It's not selfish to do that. Actually, it's a good thing to do that. In the same way that a car needs fuel to drive, you need to look after yourself, to keep your tank full so that you can continue coping. And this is the same thing we're seeing with COVID. COVID is a long distance race. It's not a sprint. So you need to pay attention to your ADL, to your well-being. Every day is very important that you look after yourself. And what do we recommend in terms of what to do that? You have to structure your day. When you structure your day, you know that there's a moment for you to protect healthy habits, to increase the positive mood, to reduce withdrawal. So it's very important that you look after yourself. Explore the importance of what does it mean to have self-care. And at the same time, model. We also have to serve as model for our family, for our relatives, in what do we mean about taking care of ourselves, engaging in managing your thoughts, your feeling, particularly during this pandemic. Apply helpful communication techniques. And why that's important? Because we want to be able to reduce, to a minimum, anything that has to be so conflicting. So reflect also how do you use this time, because this could be an opportunity to build your resiliency. It's an opportunity to be able to learn to do things that perhaps you were not doing before. So it's very important that people take time in taking care of themselves. Do things that are good for your body and for your mind. Eating healthy, staying connected, listening to your body, talking to someone that you trust, avoiding unhealthy ways of coping with stress. And what do I mean about that for us in the Caribbean? Not drinking alcohol, not using drugs. I know today is Thursday, so people think of, Thirsty Thursday, thirsty for water, thirsty for something positive. Okay, this is what we want, because when you do compound it with drugs, you know that at long term, this is not going to be good for you. And of course, in taking care of yourself, it's also important to take care of your relationship. With this time of working from home or doing a lot of, some people are working from home, or what we call teleworking, sometimes we have to be juggling with our families because our job matters to us. But you know what? Take care of your relationship. When you get sick, who's going to be beside you? It's your family. It's not your work. Your work is definitely important, but you need to manage or taking care of a relationship. You need to know what your signs of anger. You want to know what makes you angry. How do you, when you respond, don't react and think of I. It's about yourself. And you also want to be able to surround yourself of people who support you. And of course, what's important here is gratitude of the things that we have. That's very important to help you to stay well and stay calmer. So the importance of protecting your mental health, as I mentioned before, COVID is a pandemic, it's a stressful time for everyone. And people say, well, maybe more for youth, or maybe more for children, or maybe more for the elderly. It's for everyone, I think, including, so I particularly say young people, because I also think they are, sometimes we find that it's a challenge when it comes to adolescents. So sometimes I think we forget that section of the population. But it's important that we realize that it's for everyone. That it's normal to feel sad, stressed, confused at a time because it's a crisis, but that we know that we can do things to take care of ourselves. Of course, the media. So listen, one of the things we recommend is to limit the use of social media. So therefore, it's very important that when you transmit the message, you transmit message that is that you're getting the messages that are reliable, because we recommend that sometimes if the message is not reliable, so increase more fair. So you need to be very critical in terms of the message that you are producing. So because that could affect how people interpret that. So important too is the exercise or meditation or mindfulness, whatever that works for you. Make sure you're connected with your family. And if that is not working and you need time to look after yourself, reach out to a trusted adult or a professional or a pastor or someone that you trust that you can talk to. I mean, this is a time for us to find ways to get connected, to stay well. So importantly, and this is the message I want to leave you here, I'll stop my presentation, is that you need to remember that mental health matters, that there is no health without mental health. So thank you.
Thank you very much, Dr. Cayetano. And if we peep at the poll, we can actually see that 99% of people think that it's important to report on mental health during the COVID-19 pandemic. And then in terms of self-care and taking after themselves, we have only 1% that says, no, I don't. 54% says sometimes I do, and 46% says I definitely do. So I think we're all focusing on work a little bit more than we probably ever used to, working from home in a lot of cases.
Thank you. So I pass now the mic to my colleague, Elisa. Thank you, Lisa.
Yes. So Elisa's going to tell you a bit now about this campaign before we go. I think we're going to go straight to our two reporters who are going to bring examples from in the field, and then we'll have a discussion after that. But I must say here that there are a lot of comments saying thank you very much for bringing the mental health as a topic of importance right now. Elisa, over to you.
Thank you. Thank you very much, colleagues. My name is Elisa Prieto, and I'm the NCD and Mental Health Advisor at PAHO Sub-Regional Program for the Caribbean based in Barbados. And I will be very, very, very brief. I really want to hear from our Caribbean journalists, so I don't want to take up any time. Just wanted to use this opportunity to share with you about the Stronger Together campaign, which will be coming up soon. We're hoping to launch in July. And this is part of our joint project with the Caribbean Development Bank that was mentioned at the opening. And building on that project that we have been implementing for a couple of years now, aimed at building individual and community resilience in the Caribbean, focusing mainly on natural disasters, but now broadening the scope to acknowledge the needs and challenges that are brought by the COVID-19 pandemic. And I think the need for a mental health focus and for better coping strategies has been made very clear in Claudina's presentation and also in the comments that have been made in the chat. So what we're trying to achieve is to provide information, strategies to exactly do that, promote mental well-being and positive coping strategies, and at the same time raise awareness and reduce the stigma. I just saw a message in the chat saying that there's still a resistance to talk about mental health. So that is one of the objectives of this campaign. And we are trying also to convey the principles of psychological first aid and place a focus on vulnerable groups. And we've heard about some of them in the previous presentation, gender roles and how that shapes our coping strategies. And we are also trying to ensure inclusion and making all communication products accessible. So I particularly want to emphasize our call to action, and that call to action is connecting to feel safe, calm, and hopeful. And this speaks to Ashley's closing of her presentation. We are in this together, all of us, right? We really need to come together to face this pandemic. And also speaks to Claudina's presentation and how she was emphasizing that we can get through difficult times in a much better way if we manage to feel connected, if we manage to feel safe and calm and hopeful. So we're really trying to place the emphasis on those positive messages. I also want to just share very briefly that we're working on the communication products you have on the slide, a radio jingle, radio PSAs, a PFA illustrated booklet, and an audio version of that booklet, human interest stories. There will be a social media package, and brief for government officials. And this is really building on some of the materials that were produced last year and that you can access in the link below. The products that we are going to be launching soon are being revised to add some of the COVID-19 specific messages. So we will have that available very soon. Sorry, I'm having, here it is. But just to give you a snapshot of what the communication materials will look like and feel, this is a screenshot from the PFA, which stands for Psychological First Aid Illustrated Booklet that was launched last year, and that we're revising now to include COVID-19 specific messages and a greater emphasis on gender-based violence, on suicide prevention, and some of the issues that we know we're going to be seeing more and more in the context of the current pandemic. These are some images from the booklet. And with this, I'll finish. I'd just like to ask you to please stay tuned for the launch of the campaign. As was emphasized by Ashley, you really have a huge role in helping us spread this message of hope, of positive coping strategies, and we really look forward to that partnership. So thanks a lot. I'll stop there. Back to you, Lisa.
Thank you, Elisa. So we're going to go straight into From the Field, some examples of responsible coverage of the COVID-19 pandemic from the Caribbean. And we have Charmaine Clark, she's managing editor at the Jamaica Observer. And we also have Emmanuel Joseph, he's president of the Barbados Association of Journalists and Media Workers and a writer with Barbados Today. We're going to let Charmaine start, and after that we'll have an open forum. There are lots of questions in the Q&A already, so we hope we can get through all of them. If not, we will definitely answer them by email. So Charmaine, over to you.
Thank you so much, Lisa. It's a pleasure to be here. Good morning to my fellow panelists and participants. I'm going to try to share my screen in a bit. All right. So I'm really happy to be here to have a chance to share with you all just some of the examples from the field of how the reporters at the Jamaica Observer have covered COVID-19. All the desks have covered this story: sports, lifestyle, entertainment, even the food pages. But today I want to focus mostly on stories from the news desk, and I'm looking in particular on the impact of stress. From very early on in covering this disease, we realized that it was something that's going to be a challenge. People were panicking. There was this one lady, Nicola Pinnock, who said in a March 23 story that she was stressed to the max. Her parents had become withdrawn. Her sister was in tears. So as I said, mental health, from very early on, we recognized that this was going to be an issue. As the story progressed, it became clearer that there were people who were severely, severely in distress. Now I have coming up an audio file. It's a phone interview. One of our reporters, Kimon Francis, did with a lady she was in the hospital. She had been tested, and the test results were going back from negative to positive. She was worried about her kids. And I'm going to play the clip for you so you can hear her voice.
We're not hearing it as yet, Charmaine. Is it playing?
Oh, you're not hearing?
No.
Are you hearing it now?
Not yet.
All right. I'm not sure why I'm having technical difficulty. My apologies. But that was a lady who, she was at the end of the interview with our reporter, Kimon Francis. She was basically in tears, saying her kids missed her. As a mother, she felt severe stress not being able to be with them. So that was one of about 7 persons that Kimon interviewed for this story that came out on the front page of the paper, in which we gave them a voice to explain just how stressful it was to be in the hospital, being tested, and being basically in limbo. Now, when we're covering this story, there are basic elements that are, they're the ones that we rely on in our everyday sharing in our everyday reporting. But for COVID-19, they take on added significance because this is a new virus. So there is this fear of the unknown. We don't know what's going to happen next. And for many of us, it's the first time living through a pandemic. We are, all of us, living a developing story. And when we're covering this story within the context of all those points I raised, we know that we always have to act responsibly. We're reporters, yes, and we have to aggressively get the info because we want the front page, we want to beat the competition, but at the same time, we know that the info that we get, it has to be accurate, it has to be something that our audience can understand because they need the info to cope during these stressful times. So we're very clear. We do not ever want to cause panic. What we want to do is to provide accurate, timely, and useful information. Because one of the things that is very, very clear to us here in the newsroom is that if you are in doubt, you check. If you're still in doubt, you check again. And if you're still in doubt, you leave it out. I'm going to now touch on a few examples of how we cover the basics, a few stories. One of the things that we've tried very hard to do is to provide easily accessible information. So we had a special section done up on the website. We also realized very early on that there were myths out there. People were hearing all these rumors and misinformation. So we tried our best. Every now and again, across 2 pages, we would have these fact sheets, myth busters. And this is an example of one of the sheets that we carried. It addresses issues in terms of the sunlight and how effective that could be in combating COVID-19. When we cover the story, we look at the big picture. We look at the economic impact. We look at the impact on the various sectors, tourism, agriculture. But we do this by bringing you stories of individuals, the real people. We had, for example, many stories of cruise ship members who were stuck at sea. And this was a global problem. So we had Jamaicans, of course, among the group, and they were stuck. And they kept saying, we want to come home, we want to come home. So we gave them a voice. There was this one example, though, of this one set of cruise ship members who wanted to come home, but they had a caveat. They wanted to come home on their ship because they were afraid if they got on an airplane, they would get the disease. So they reached out to us and said, can you help to share our story? We also tackled the issue of stigmatization. That has been a big thing here. The government has said consistently to persons, do not stigmatize those with the disease. We had one case where this one lady called the newsroom and she was in tears because her husband had been on a cruise ship. He was tested after he returned home. He was negative, but then the way in which he was returned home, it led to some embarrassment for her. And the headline was, they steal the joy. Because here it was, her husband was coming home. He was in this big yellow bus. There was a police escort with the lights flashing. There were soldiers with long guns, and all the neighbors came out to look, and she was embarrassed and afraid. So we gave her a chance to have her story told. So again, the focus for us is always on real people. Now, in all of this coverage, COVID fatigue sets in. The public, sometimes they just don't want to hear about COVID-19. So what do? We try to find different ways to tell the story. And what we like to do is to provide stories that give people a boost, a feel-good response. So for example, we had this one story of a bus driver who got the disease he contracted the disease from a passenger who was in his vehicle. And the time during which he got the disease and to when they called him because they found him through contact tracing, he had been going about his business. He had other persons in his bus. He was interacting with his mother who is elderly and has underlying conditions, interacting with his child. So when we spoke to him from his hospital room, he was basically saying, look, I had to go on social media because there were rumors about my entire family having the virus. I want to clear the air. I'm the one who has it. And then we put the question to him, what would you say to the person who gave you the person who gave you the disease? And he said, actually, she's in the bed right next to me. And I've told her that I forgive her. So again, we were very happy to bring that story to our readers. We also looked at those on the front lines. Our Health and Wellness Minister, Christopher Tufton, has been one of the persons that we've seen on the press conferences. And we do have extensive coverage of the press conferences. So we wanted to know how he was doing because sometimes he would look really, really tired. So our reporter, Mark Cummins, went and spoke to him and asked him, what is it like being the health minister during this time, during this pandemic? And he said, yes, it's challenging, but he also said it's satisfying. So stories like those, who are the real persons on the front lines? How are they doing? We also had our reporter Candice Knight do an interview with our Chief Medical Officer, Dr. Jacqueline DeCesar McKenzie. And during the press conferences, she's always so calm and reassuring. So we wanted to know, where does she get this reserve of strength from? And Candice's story delved into that and looked at her as an individual. Then on Mother's Day, we had our lifestyle pages bring our audience members interviews with 11 moms who are medical health practitioners. Real heroes wear scrubs. That's the way we put it. And I want to play for you a very, very brief clip of her. I hope this one works. It's a video clip. And she's talking about what it's like for her as a mental health professional on the front lines. So if you can't hear it, let me know.
Not hearing it yet. Is it playing?
You're not hearing?
Oh.
All right. I'm sorry. My apologies. It worked yesterday during the test. But anyway, she was basically saying that it was mentally draining and it was very stressful. So her eyes just changed as she spoke. And again, real heroes on the front lines. So our role in all of this, when we interview these people, we see them as not just statistics, not just the health minister, not just a doctor. They're real people. And even after we have the stories in the paper, we keep in touch with them. So we found that we are increasingly providing support. Reporters have become lifelines. We have a WhatsApp line and people call in. This morning, there were people saying they were still stuck in Antigua. So we do get the calls. We do hear the cries for help. So we, as it was mentioned before, we are also on the front lines. But then we know that it's all worthwhile because we know we're making an impact. So the audio clip I was trying to play in the first slide, we had a patient who was crying because she was away from her kids. Well, the day after, she and others, they contacted the reporter, Kimon Francis, and they said, thank you so much, because their treatment had improved. So these kind of things, these are the things that make us feel that what we're doing is worthwhile. It's a big part of why we do what we do. It pushes us to be better, to do more, and more importantly, to keep listening to our audience. So these were just some of the very, very few examples of how we covered COVID-19. I thank you so much for listening. Back to you, Lisa.
Thank you so much, Charmaine. That was great. I'm sorry that you didn't get to hear those.
Yeah.
But we did get them to play yesterday, so I don't know if we'll be able to share the presentations and find a way to embed the links. Maybe we can share those with participants who are online and those who may not have registered but were not able to join. I'm going to hand over now to Emmanuel. Emmanuel is going to bring his story from the Barbados side and how things were covered from his angle. So I'm going to hand over now to Emmanuel. And then we have a whole bunch of questions in here. We have questions about immunity for Aldana. We have, statements about domestic violence and journalists and their ability to communicate, how they're dealing with this whole thing. So after you, Emmanuel, we'll have a chat.
Yes, thank you very much. Can you hear me? Loud and clear.
Okay.
Thank you very much. As been said before, my name is Emmanuel Joseph. I'm the president of the Barbados Association of Journalists and Media Workers and a senior writer with Barbados Today. That's an online multimedia platform. Now, I'm talking today about the effective and responsible reporting during COVID-19, the Barbados story. Now, in my quest to address situations of responsible reporting during COVID-19, I cannot resist incorporating effective reporting as well. So in order for us to get a better understanding and appreciate the subject matter, let me first define responsible in this context, bearing in mind that the word has different meanings. So for the purpose of dealing with responsible journalism and responsible reporting, it means making good decisions and caring for others. Let that sink in. With respect to effective reporting, it means successful in producing a desired and intended result. Let that stick also. The rest of the title speaks for itself. During COVID-19, the Barbados story. Therefore, to simplify and give a greater clarity to my discourse, I would say the story I'm going to tell you is about making good decisions and being sensitive to other people's feelings while trying to ensure that I get the big story. Now, the following events and names in this presentation are all real, no fake news. So that is my cue to recall how the media and the government dealt with false information that infected Barbados, especially during the early weeks of the pandemic. I will take you back to an event involving the spread of false information on the COVID pandemic across social media, which resulted in then acting Prime Minister Cynthia Bradshaw versus the Barbados Association of Journalists and Media Workers. And for short, from here on, we'll call it BARJAM. That's the acronym for the association. This presenter, in his capacity as president of BARJAM, issued a strong press statement calling on the acting Prime Minister to clarify and to retract certain remarks she had made at a COVID-19 press conference on Thursday, April the 2nd, in which she suggested that the local media were disseminating fake news on the pandemic here. The BARJAM statement said, which was published in the local press, and we quote, the Barbados Association of Journalists and Media Workers is calling on the acting Prime Minister to clarify her statement, and there's a lot of fake news circulating in the media. During the post-cabinet presentation on the COVID-19 pandemic currently affecting Barbados, and I'm still quoting, Bradshaw told Barbadians to pay attention to the updates from reliable sources, and she only mentioned the Government Information Service. Now, she then went on to tell the country that the media were circulating fake news with respect to the COVID-19 crisis here. This statement has the potential to give people the impression, and I'm still quoting, especially at this time when the island requires information on the social and the local situation, that they should not rely on the media for it. Barjam would like to think that the acting Prime Minister made a very bad choice in the use of her language and is urging her to retract the statement and provide clarity to her intended message in the interest of the integrity and reliability of the established and reputable media houses in this country, unquote. Now, speaking on Down to Brass Tacks, that's the radio call-in program on Sunday, April the 5th, Ms. Bradshaw issued an apology to the media fraternity and said she did not mean the mainstream news media. She was talking about the social media. Now, the biggest irony about this is that, in my opinion, the message conveyed by the language used by the acting Prime Minister at the time amounted to fake news. Between March and April, the false news surrounding the virus and the health protocols intensified on social media. Despite the appetite for news, all the responsible media houses in the country refused to be duped into running full steam ahead with such information before seeking clarity and confirmation. That clarity came from bona fide sources. And one of those bona fide sources was the Prime Minister's Press Secretary, Roy Morris. Now, he took to the airwaves on All Fools' Day to dispel a hoax on social media in the form of a fake official gazette. Now, that's a statutory instrument. When things pertaining to the government are published in that official gazette, it becomes official. Now, the news, the hoax, was published in this fake official gazette on the state of emergency in Barbados, which purported that the island was advancing its plans to combat the COVID-19. Of grave concern to Mr. Morris was the content, which stirred up much fear and panic in Barbados, claimed that certain districts in the island would be under police guard and that residents would not be able to move around. The false news and harmful messaging continued their viral rounds on social media with what this presenter describes as an image and credibility attack on a local media house. Now, remember, this is an attack of tremendous and damaging significance. The false news and harmful messaging, which was directed at this media house, it used the media house's masthead. Think about that. It used the media house's masthead to propagate false information. The culprits posted a story online, and this media house is an online multimedia, which spoke to elevated numbers of persons being COVID positive beyond the country's national tally at the time. That, of course, was dismissed. A popular supermarket was also targeted when a voice note was circulated on social media saying that one of its employees had tested positive. The Bridgetown port had to refute a rumor about its handling of cruise passengers with regard to the virus. A livid Prime Minister's Press Secretary told the country that this kind of maliciousness could not continue, especially considering that people were doing immense damage to others and setting up others to create mischief, to literally ferment unrest. It is heartening to report that in the midst of all these juicy stories, none of our mainstream media houses acted irresponsibly by publishing or broadcasting the information from the prankster's point of view. I spent a lot of time on the false news because of the potentially devastating and widespread impact such information could have on a nation, people, its economy, its social services, its stability, and its international reputation, especially when picked up by foreign investors who may continue to believe it despite assurances by the government. Let us turn our attention now to the matter of how the media have been responding to changing information coming from official sources with respect to the virus-related issues. Now, how the media report on these matters is especially crucial simply because populations need the correct information, or should I say, the updated information in order to make right decisions about their lives during a health crisis such as COVID-19. In the early stages of the coronavirus, just after the first 2 cases were identified, here in mid-March, the media were reporting on the Ministry of Health's official position that the wearing of masks was not necessary. But in their efforts to be effective journalists, as they make good decisions, media workers who had been checking out developments on the global front realized that the stance adopted by the Barbados government was in variance with that of the international health agencies in wearing of masks. So the then acting chief medical officer, Dr. Anton Best, was asked to address the 2 positions during a press conference to update the country on the disease. On Sunday, April the 5th, Dr. Best reassured the public that as the research continues and new findings come to light almost daily in relation to the COVID-19, if the directives or measures needed to be amended, there would be. Now, in a response to a question about the wearing of masks, he said that in light of the fact that the Centers for Disease Control and Prevention in the United States had now directed that masks be worn, government had to change its position. Dr. Best declared, and I quote, "We no longer object to such," and that the ministry now shares a similar position. So Barbadians had updated information to assist them in reducing the spread of the virus and to give some measure of protection to them and others. I can also tell you that government has moved from a position of no mask to one in which no less a person than the Prime Minister even recently threatened to make it mandatory because some people were flouting the directives to mask up. The population was also informed through the mainstream media that at first, persons were not tested at the ports of entry, but now they are. Why? Because the authorities have indicated that within the spread, that with the spread now under control, it does not intend to do anything which could spark a new wave. It is fair to say that because of the constant flow of information coming from the Ministry of Health officials and the Prime Minister on matters surrounding the illness, the media have been in a position to keep the country abreast of developments affecting their lives and from bona fide sources. For example, the regular updating of health and safety protocols to be implemented by various sectors for the gradual reopening of the country has been reported by media outlets. The changing curfew hours, the growing numbers of people who could assemble, and the widening of the businesses which could reopen have all been welcomed by Barbadians thanks to the reporting of our media professionals from bona fide sources. And in conclusion, I can report that up to today, there have been no major difficulties in accessing information related to the virus in Barbados. In fact, there's a constant flood of messages flowing through the electronic, print, and digital media, encouraging citizens to mask up, sanitize surfaces, wash your hands, stand home, that's a Bayesianism, and physical distancing. In addition to that, all the print and digital media publish a situation report which is updated every day with information from the Barbados Government Information Service that breaks down the local statistics on confirmed cases, the deaths, the isolated persons, the recoveries, tests, age range, and gender. There's also a section in that report which shows the global totals for confirmed COVID-19 cases, deaths, and recoveries. While the information I provided to you is by no means exhaustive, at least it gives you a clearer understanding of the Barbados story from reporters who have tried to make good decisions and be sensitive to the feelings of others while pursuing that big story. Thank you.
Thank you so much, Emmanuel. That was such a great story. You're such a great storyteller. That was very interesting, very exciting reporting there from you as well. And talking about, you know, a lot of these themes came back. I remember Dr. Cayetano said your words are so important. The infodemic that Ashley spoke about, the devastating consequences that they can bring. I'm going to just jump straight into the questions because we're already a bit over time, but if you all are willing to stay for a couple of minutes more, we'll just go through a couple of them. I think this one follows on really well, and Ashley and maybe Charmaine and Emmanuel, you can respond. Angelique Donahue is asking how with the information changing so quickly, how can we regain trust? How can we get the public to trust our information when we're encouraging the public to seek information from reliable sources, but sometimes it's so fluid and it keeps changing. I don't know, Emmanuel, if you wanna give your view, and then the others can.
Yeah, well, yeah, because this virus, as they said, the verdict, the jury is still out on various aspects of it. So the authorities can only go with what they have, and when the research shows something different, then you publish that. So that is the answer. It's not a question of not trusting. The question of what you have to go on, because it's a fluid situation with respect to this virus.
Just to add to Emmanuel's point, I think one thing that our spokespersons and that spokespersons from other organizations have been really good about with this pandemic is being very upfront about the fact that this is a new virus, that information is changing, and that recommendations may change as a result. So I think it's just important to continue to inform and reassure in a certain way the public that we're still learning, we don't have all the answers, and that recommendations are changing because of that, and not because for any reason that might imply a violation of trust. So I think it's just about being open and honest to the media that we know a certain amount, but we don't know everything. And it's fine for us to admit that, you know, as media professionals, as professionals working for public health agencies, we don't always have all of the answers. But so long as we're upfront with that, then I think people will expect us to reassure them and to change recommendations as and when those recommendations become available.
Charmaine, did you want to add anything?
Well, I could add just a little bit. Again, you just have to be honest. We've stressed from the very beginning that yes, it's new, and we're being guided by the persons who know, and then we find out the persons who know don't know, but that's fine. As information changes, as it becomes clearer, then we try to bring the latest to our audience. And if it is that we got something wrong, we immediately try to correct. So that's also very important in terms of regaining the trust of the audience.
Okay, thank you very much. Dr. Cayetano, we have a question about suicide and covering suicide during the pandemic. We know there are increases in anxiety and depression and economic challenges. How do we, as the media, inform the public of the severity of mental health? And in particular, how do we cover suicides in a responsible way?
Thank you very much for the question. And as you know, one of our webinars will be on responsible reporting. And I really like when Emmanuel talks about responsible reporting. We want to make sure that the media is reporting responsibly about suicide, in particular because of the issues of copycat. So we have guidelines that are very clear in terms of what is not recommended for responsible reporting. We're not saying don't report, We're not saying don't report. We want you to report, but how do you report that? So we want you to report in not sensationalizing it, making sure that when you're reporting it, confidentiality, don't include all the locations of the victims, or talking about, if there was a letter or present. Sometimes they report showing the letter. That is not good for the family. That's not good for people who are, the people who are left behind. So you want to be respectful to that. You also want to make sure that it's an opportunity to provide information on where to look for help. What are the signs that people may have when they become like signs of hopelessness, helplessness, anxiety, not sleeping, and then we know that sometimes people may become impulsive, but at the same time, I think it's very important that signs of distress, are incorporated, where to go look for help, making sure that they also, if you need to rather interview a family member, interview a professional to talk about suicide. So I don't want to extend so much, but I know we have a section only for responsible reporting on suicide, and we did a training already for journalists in Trinidad and Tobago in terms of looking at responsible reporting. So I know that it's an important issue in the Caribbean. At least one death by suicide is already too many. So we need to make sure that we don't create this copycat. When you sensationalize this, people want to be able to know what happened and how to do that. But again, here, we will talk about the reporting. When you say also the responsible reporting, even in terms of, we say committed suicide, we no longer use the word committed suicide, because commitment is punitive. Is if it's, people suffer. So we talk about die by suicide. So even the word that we use is also very important to capture that. I want to
talk about that.
Here,
That's interesting.
and then I will come back to when we do the training on suicide on that.
Okay, I've never thought about that word, committing suicide. That's very interesting. Aldana, we have a couple questions on immunity. How can you become immune without a vaccine? There are a couple questions on that. I don't know if you got a chance to look in the Q&A. Could you address quickly immunity? Because we want to wrap up in about 7 minutes or so.
Sure, and Elisa had been, are you hearing me? Okay, great.
Yes.
It just started to rain, I wasn't sure. So Elisa had asked me to check the chat and see if I can address the question. So in terms of immunity, yes, there's no vaccine. We have no treatment, but all is not lost, because we have other diseases like that, like dengue. There is no vaccine for dengue. They've been looking for one for decades. And there's no cure for dengue, but our healthcare providers know how to treat the symptoms of dengue. This is the same thing with COVID-19. There's no vaccine, there's no cure, but depending on what the symptoms are, our healthcare providers know how to treat the symptoms that present themselves. So all is not lost. In terms of natural immunity, we have no evidence of anybody having a natural immunity to say that they are immune without a vaccine, or that they've been immune without having the disease. We've not seen that at all. We have no evidence to support that. So how do you become immune? Well, normally when you get an infection, you become immune to that disease because your body produces antibodies to it. And it's like it already knows the recipe to make these antibodies if they see the virus again. So that's what we mean by immunity. As soon as it sees a virus a second time, it immediately starts producing antibodies and kills it before it can make you ill. So yes, normally when you have a disease afterwards, you will have immunity. What we do not know with COVID-19 is how long immunity lasts. For some diseases, we know it can be a lifetime, but others, it's just a short time. For example, I'm sure you're aware that sometimes you may get influenza maybe once in a flu season. It doesn't necessarily give you lifelong immunity. So can you become reinfected was a question I saw. Probably. We don't know yet for sure, but it seems likely, as we see with other coronaviruses. But how long you remain immune until you are able to get infected again, it's one of those things we just don't know, and only time will tell. There's a lot of investigation going on. Related to that, shall I just deal with the couple questions related to that, Lisa?
Much covered it. And I think we can move on to, because there are probably two more I want to get to before we wrap in 5
Okay,
minutes, if
sure.
that's okay.
Sure.
Ashley, there's a question for you about tackling rumors and fake news head on from Rihanna McKenzie. Do you think that credible media houses should actually attack those rumors and fake news and actually try to get the real story out there, the correct news?
Yeah, I mean, I think there's a couple of ways of doing it, but certainly the way that the AFP are doing it, which is the examples that we used in my presentation, are by, this is fake news, or fact checking, and it's fine to say that, but at the same time, it's a delicate balance between not giving too much airtime and sort of perpetuating the conversation around something that's erroneous and then just dispelling it. So I think maybe a good way to deal with it is to dispel it and then to move on. And if it rears its ugly head, we knock it down again, but then, we don't keep on sort of fomenting the conversation around it.
I see Emmanuel is shaking his head. You want to say something?
Because even in Barbados, I don't know the rest of the region, there's an unwritten rule among media houses not to publicize, say, bomb scares. It is kind of fueling the people, stupid people, to do these things. So we do not publicize bomb scares, right? So it's like giving publicity to these pranksters and so on,
Understood. And I think this might be the final one, depending on who answers. Does PAHO have any advice for helping employers to have a better understanding of mental health? And these are employers of journalists and employees in general. The question is that many people don't seem to understand how important mental health is. Will there be a workshop for employers? Elisa, is this something that we need to continue to discuss? And for Dr. Cayetano, there's a question about the mental health of journalists. And I know that's something that you're very passionate about talking about, and maybe doing more on self-care for journalists as they are frontline workers. Dr. Cayetano, did you want to address this, or Elisa?
Yes, for sure. Can you hear me? I think
Yes, we can.
Oh, okay, thank you. No, for sure. I'm really, wow, I'm very, very, very glad, very happy to, that there is that interest on mental health, clearly. As I mentioned before this, and I think I saw in the chat, someone talking about stigma. And this is one of the reasons why it's so difficult to talk about mental health, because of the stigma. So people don't want to discuss this issue. They prefer, as I mentioned, you suffer in silence, you keep it to yourself, but you don't bring it on forward. It means that if you do it at work, you may lose your job. It means that if you do it at school or wherever it is, people look at you as weak. People have different interpretation of that, rather than looking at it as, being brave and courageous. And I think the media plays an important role in terms of demystifying, in terms of lowering the stigma, talking about people, interviewing people who are comfortable to talk about their experience. The best way to fight stigma for mental health is social contacts, people talking about how they have been coping with an issue. And as you know, nowadays, we don't like to, you don't want to be about, it's not about statistics, but you know that there's a statistic in terms of 1 in 4 suffering mental health problems. So we have 100 people on this, over 100 people participating. There's a chance that some, 25 probably have mental health problems that can be diagnosed, that can be treated. And we recommend that we do take time in talking about mental health, because otherwise, when we were talking about the stress of the anxiety, the fear, not sleeping well, not eating well, and all of those things, that affects the way how you take care of yourself. That affects the way how you take decisions. That affects the way, if you're miserable, irritable, impacts your relationship. So mental health definitely is important.
Yes. Thank you very much, Dr. Cayetano. We're going to have to leave it there. I'm so sorry. We're going to get kicked out of the room soon, because we only have it for a certain amount of time. I want to thank all of you so much for taking part. There is an evaluation form there that should have popped up. If it doesn't pop up, we will send it to you. I want to thank everyone for joining us today, all of the advisors, and to Ashley and to Emmanuel and Charmaine, and of course to everyone who did their opening remarks. And we want you to make sure you go watch it again if you missed something or you were distracted at some point. So thank you very much for joining us. Look out for the next one. We'll be coming at you with another one very, very soon. Thank you very much and continue to enjoy the rest of your day. Thank you and bye-bye.
Thank you. Bye.